All right, let's jump right in. Today, we are talking about something so important: the shift in how we think about early detection for breast cancer. We're moving away from a strict, old school routine to something way more intuitive and powerful, and that's self awareness. So, this is the big question that gets right to the core of it all. What really is the difference between a rigid routine you have to remember and an awareness you just have? Understanding this is key to how health experts want us to approach our own health. And, this whole thing really starts at a personal level. It's not about some dry medical chart or statistics. It's about you, your body, and the simple, quiet power of just noticing. That's exactly it. We're not talking about complicated medical procedures you're supposed to do at home. It's not about anxiously searching for something wrong. So often, it just begins with a quiet moment, a simple observation you make about yourself. To make this real, let's talk about Asha. One morning, just going about her day, she notices something. It's not a big deal, there's no pain at all. It's just some weird dimpling on the skin, a little bit of redness. It just feels off. And that little feeling, that's the spark. That's awareness kicking in. Okay, so this brings us to the main event. Why have the official guidelines from health experts all over the world changed? Let's break down this huge shift from formal exams to simple awareness. Think about it this way. The old method, that formal self-exam, was like a stressful monthly checklist. It actually caused a lot of unnecessary anxiety for people. But the new approach, self-awareness, is so much simpler. It's just about knowing what's normal for you and casually noticing if something changes while you're showering or getting dressed. It's empowering, not scary. And look, this isn't just a trend. This is a globally recognized official best practice. The World Health Organization, the WHO, is crystal clear about this. They recommend breast self-awareness, getting familiar with your own body, over that old structured self-exam model. That's a massive endorsement. So, you notice a change. Now what? Well, awareness is the critical first step, for sure, but it's what you do next that holds all the power. Let's walk through the clear, simple game plan for what to do. And here's why that action is just so vital. It's a plain and simple fact in medicine. The earlier something is diagnosed, the better the outcomes are likely to be. For someone like Asha, that first little moment of awareness was the first step on a path to a much more positive result. Okay, here's the action plan. And honestly, it's pretty straightforward. Step 1, notice a change. That's the self-awareness we've been talking about. Step 2, and this is the big one, talk to a doctor. Don't put it off, don't second-guess yourself, just make the call. And step 3, listen to them. Follow their professional guidance about screening. It's a totally manageable path. Now, when it comes to routine screening, just the regular checkups, the WHO does give a clear guideline. They recommend routine mammograms for women between the ages of 50 and 69. That's a key piece of information for public health. But, and I can't stress this enough, this might be the most important takeaway: symptoms don't check your ID. That age bracket is for routine screening when you don't have symptoms. If you notice a change, if you have a symptom at any age, that is your signal to act right away. Your own awareness always trumps a general guideline. This entire approach is shaped and supported by the biggest names in health all around the world. This isn't just one person's opinion. It's a global consensus that's been built on years of data and experience. For example, right here in the United States, the CDC has an entire group dedicated to this, the Advisory Committee on Breast Cancer in Young Women. This just goes to show how focused the effort is on getting the right message and support to everyone, including younger women. And it's not just an American thing. If you look across the Atlantic, you've got Europa Dana, the European Breast Cancer Coalition. This is a massive organization that works across dozens of countries to make sure this message of awareness and early action is heard everywhere. It's a truly global effort. So let's bring this all full circle. Let's get back to where we started, with a personal story and a path that leads straight to a hopeful future. This is the payoff. This is what it's all about. Because Asha was paying attention to her own body, because she spotted those early signs, and most importantly, because she took action right away, she is on the road to recovery. You can draw a straight line from that initial awareness to a hopeful outcome. It really does boil down to this simple, powerful idea: know the signs, act early, save lives. That's the message. That's the whole story.
And so we'll leave you with this final thought. This isn't just information. It's really an invitation to be an active partner in your own health. You are the absolute first line of defense. The only question left is, are you listening